In the previous video, we have already talked about anatomy of biliary apparatus, pathway of bile and abnormality on its way, and also about the pathophysiology of gallstone formation. So whoever didn't see the video, check the link given below in the description box. Now let's discuss about the clinical correlation of gallbladder. For this, again I would like to draw the outline of biliary apparatus. Cholelithiasis means formation of gallstone in the gallbladder itself. Cholecystitis, which refers to the inflammation of the gallbladder due to cholelithiasis. There's also a term which is known as acalculous cholecystitis. Cholecystitis without gallstone formation, small bits of materials in your gallbladder that form a kind of sludge. Cholelithiasis, presence of gallstone in the common bile duct. Cholangitis, inflammation in the common bile duct. Biliary colic or gallstone attack. Time to time severe spasmodic pain is called biliary colic. Steady or intermittent pain in the right upper abdomen, usually under the right side of the rib cage. Symptoms of gallstone attack: fever, nausea, vomiting, sharp pain in the right upper abdomen for more than 6 hours, made worse by pressing or breathing deeply. Pain may spread right shoulder blade or back due to same segmental supply. Tenderness over your abdomen, sweating, loss of appetite, feeling sick. To identify the patient of cholecystitis, physicians always prefer to perform a test which is known as Murphy's sign. To perform the test, the examiner firmly placed his hand at the costal margin at the tip of the 9th costal cartilage in the right upper abdominal quadrant and asked the patient to breathe deeply. On inspiration, the gallbladder comes into contact with the examiner's hand and pain occurs. There are two types of cholecystitis: acute and chronic. In case of acute cholecystitis, an attack of gallstone pain usually lasts from about 30 minutes to 2 days, and attacks may be severe and last longer. In case of chronic cholecystitis, pain will be less severe and not last as long as with acute cholecystitis. How can physician differentiate cholecystitis with cholangitis? In case of both cholecystitis and cholangitis, patient may have associated features of fever, right upper abdominal pain, increased WBC count. But in case of cholangitis, there will also be presence of jaundice. Murphy's sign will be positive in case of cholecystitis and negative in case of cholangitis. Investigation of gallbladder disease. Blood test. Increased WBC count will be found. Ultrasound scanning shows distended and edematous gallbladder. Plain abdominal radiographs may show radio-opaque gallstone in about 10% of cases of acute cholecystitis and gas within the gallbladder wall in emphysematous cholecystitis. CT scan, biliary scintigraphy, hydroxymonodiacetic acid (HIDA) scan, which is the gold standard investigation when diagnosis remains in doubt after ultrasound scanning. There are two types of management given to a patient of cholecystitis. One is medical management. Patients suspected of having acute cholecystitis should be referred to hospital immediately. First-line treatment include fasting, IV fluids, antibiotics, and analgesia. Patient won't be able to eat or drink, so first-line treatment should be recommended. Another one is surgical management. Cholecystectomy, which means the operation for removal of gallbladder. Within 24 to 48 hours of admission, cholecystectomy is preferable to delayed or interval surgery. Percutaneous cholecystectomy, which is safe alternative to cholecystectomy for very ill patients or those unfit to undergo surgery, such as older patients having diabetes or other serious complications. Complications of gallstone formation: gangrenous cholecystitis or gallbladder perforation. The gallstones may penetrate the wall of gallbladder and duodenum to get into the lumen of duodenum. These stones travel through the coils of small intestine and may block the narrow ileocecal junction, leading to intestinal obstruction. As you can see, I have already made a chart while making this video, so if you want to note down, you can take a screenshot of this.